Good afternoon. Hope all is doing well today. We are here today for our weekly COVID-19 update. And again, I am happy to say we are COVID-free. I now turn this over to our health department, starting with Mona Zavante.
Thank you, Chairman. Good afternoon to the Winnebago community. I wanted to give a few updates and requests. We want to ask all of our sewers in the community if you have the ability to make homemade masks, if you could contact our CHR department. We have several members of our community that would like to have a mask. We do have a waiting list. We also want to encourage everyone to wear a mask when shopping or interacting with others that don't live in your home. Please send only one person to the store if you're able to, in order to really limit the amount of people that are being exposed to others. If you're experiencing any symptoms or need to ask any questions, please call the hotline at 402-922-1508. We are following up and monitoring everyone that is coming to our attention. The CHR, diabetes, and PHNs have been checking on the vulnerable population. If you have been not checked on and would like to be, please call the PHN department to get on the list. If you become sick, please call the hotline so that we can assist and troubleshoot your symptoms. I want to thank all of the community for all their compliance with all the safety and health measures that we have taken and put into effect in these last few weeks. I know that there has been a very high level of stress, and we are trying to take all the measures that we're able to. If you are needing someone to speak to, or you feel overwhelmed or stressed during this time, please call either the crisis phone at 712-259-3263, or call our behavioral health program at 402-878-2911. I appreciate all the support from the Tribal Council and the community that has provided during these uncertain times. Thank you to all of our Winnebago Public Health Department and 12 Clan staff for their work that they have been doing and for the preparation over the past few months. I would like to turn it over to Angie Keller, our Public Health Nursing Director.
Hi, everyone. I'm Angie Keller, and as Mona said, I'm with the Public Health Nursing. We're going to go over the COVID-19 preparedness and response that we've been doing over the past couple months and give you an update. So the statistics as of yesterday, the total cases in the U.S. was 579,005 cases. The total deaths in the U.S. were 22,252. Of those cases, 6,814 were found to be travel related. And then 14,728 were found to be related to close contact. In the state of Nebraska, there were 901 cases. It was a total of 20 deaths. There has been 10,828 negative test results. And then there has been 11,757 total tests complete. As Chairman Brown has said, there is 0 cases in Winnebago. The 12 Clans Unity Hospital, or WCHS, has tested a total of 8 patients. And then of those 7 are negative, there is still 1 that is pending. So that one is not positive. We don't have any cases, there's just 1 pending. Kind of want to go over the symptoms of coronavirus. So the most common ones are those that are flu-like symptoms. So that's going to include fever, cough, shortness of breath. There have been other ones that have been discussed, and those can include extreme fatigue, diarrhea, upset stomach, and then loss of taste and loss of smell. Those aren't as common, but they definitely can be present with anybody that has the COVID infection. The symptoms usually appear anywhere from 2 to 14 days after they've been exposed. It's really important that if you do experience any of these symptoms, that you do contact your healthcare provider or call the Winnebago Public Health Department, and we can help kind of triage and figure out what actions need to be taken if you can self-care at home, or if you need to come in and be evaluated, or if testing is needed. And then we also want to know if you've been in contact with anybody that's been COVID positive during that time as well. So as Mona has stated, there is a need for homemade masks, and I want to go over kind of the directions and guidance for homemade masks and what to do with those. We are asking that all community members should start wearing a cloth mask when social distancing is not possible. And the people that should not be wearing one are children under the age of 2, anyone that has severe trouble or difficulty breathing, and then anyone who is unconscious or incapacitated, or they are not able to remove the mask themselves. The face masks or those cloth face masks should be worn inside and outside whenever social distancing is not available. So whenever you're not able to maintain that 6 feet distance between you and somebody else. And then especially when you're going to be out in public. So that's running any essential errands, and that should be 1 time a week with only 1 person doing them. And that's such as going to grocery stores, gas stations, getting the mail, or anything along those lines. As Mona had mentioned, the CHRs are helping with getting the cloth mask out to the public, but we are accepting donations, and those can be delivered to the Rolling Thunder, or you can call the CHR program. The CHR does have a current list of any community members that is requesting a mask, and then once one is available, they'll contact you and get that out to you. The guidance for homemade masks and when to use them and how to care for them. You want to make sure that you're avoiding touching your face. When you start wearing a mask on your face, it's just natural to go and touch it and move it and adjust it more frequently, but you need to really try hard not to do that and to refrain from touching your face as much as possible. If you are going to touch the mask, or if you have to readjust it, you want to touch the outside of the mask or the ear loops. If you can refrain or stop yourself from touching the complete outside of the mask and maybe touch the bottom where it's less dirty or less contaminated, that would be better. But you want to make sure that you wash your hands before and after touching your mask every single time. That's going to stop the spread from anything that's on the mask going to a surface and then contaminating that surface and having somebody else be exposed to it. All cloth masks should be washed daily or after every use. You want to wash it in the hottest water setting that the fabric will allow with just the acceptable amount of detergent, so whatever the normal amount of detergent is, and then you want to hang that to dry. You don't want to lay it on a counter or anything to dry, because then that will allow for whatever's contaminated on the counter to get on the mask, and then that defeats the purpose of washing it. I want to make everyone aware that each one of you is the first line of defense for protecting yourself from the COVID-19 infection. We have to make sure everyone's taking the proper precautions, practicing the social distancing measures, wearing face masks when out in public or when social distancing isn't allowed, in order to make sure that everyone's staying safe. We have to make sure everyone's doing their part to flatten the curve and to keep the Winnebago community healthy and safe. And then here's kind of a graphic for the guide for using masks. You always want to make sure that you're washing your hands either with alcohol-based sanitizer that's 60% or higher, or with soap and water, and you want to wash your hands for 20 seconds if soap and water is used. Cover your mouth and nose with the mask. You want to make sure you limit the amount of gaps that are around your face. If what you can, some of them do gap a little bit, but just make sure your nose and your mouth are covered. And then replace your mask with a new one if it gets damp, soiled, or if it's dirty, or if they're single use. You don't want to keep using them if they're single use masks. And then make sure that you are washing them if they are cloth masks, which will go to the next one. And then to remove it, you do not want to touch the outside of the mask. You want to just take it off with the ear loops or with the ties, and just take it off and then dispose of it in a garbage bin. And then immediately wash your hands with soap and water. And those are for like the more surgical masks. For the cloth masks, for maintaining those or keeping those, like I said, you want to make sure that they are washed with the hottest water as possible that the fabric will allow, and then hang them to dry. And then, like I said, you want to avoid from touching the outside of your mask, touching your face, and readjusting as much as possible. It is hard, but it is something that needs to be done. And then I want to go over also what to do if you do become sick, or kind of the self-care measures that we've all been talking about, just to clarify those a little bit. So self-care means just caring for yourself at home. The COVID virus, there isn't any medications or treatments that are available to actually treat the virus. We just have to treat the symptoms that somebody has or the complications that arise from the infection. So that's where the self-care comes in. So you want to make sure that you're staying home from work or school When you're sick, avoiding going out in public places. Try to avoid using public transportation or anything that's going to affect that social distancing or that 6 feet distance between everybody. If you do become sick, it's important that you do monitor your symptoms carefully. You want to make sure you're checking your temperature, you're monitoring your breathing, if your cough, if it's getting worse, if it's changing, if it's getting deeper, if it was a dry cough and now it's productive, or you're getting some phlegm or sputum with your cough, you want to make sure that's being monitored. And if there are changes, to notify your healthcare provider or the public health department. It's really important that you stay home and that when you're there, you're getting rest and you're drinking plenty of fluids. That's going to be the best thing for you to do in order to help overcome this infection, but you have to make sure you're doing that. If medical attention is needed, then please call your healthcare provider, and then we will, or the public health department, and then we will triage everything and get you either appointment to come in and be seen or the information or guidance that is needed at that time. And then if emergency services are needed, so if you have any difficulty breathing, shortness of breath, any coloring around your blue coloring around your lips or nose, you do need to call emergency services, and then they will come out and help you. But you have to make sure that they know about your symptoms and then the status of your COVID. So if it's a known COVID case, if you've been positive, if you've been in close contact, or if you've recently traveled, all that information does need to be passed on to them. When you're at home, you want to make sure you're always covering your cough and your sneezes with a tissue and then disposing of that right away, and then washing your hands immediately afterwards. Hand washing, good hand hygiene is washing with soap and water for 20 seconds or using 60% hand sanitizer or 60% alcohol. That's a hand sanitizer. You want to stay away from people as much as possible, especially within the home. If you're not feeling well, you want to try to isolate yourself into a room and use a separate bathroom if available. If that's not available, then the bathroom should be cleaned after every use with that sick individual. After that sick individual uses the bathroom, make sure it is clean, so then the contamination or the exposure that would have happened is decreased. You want to avoid from sharing any personal items, so that's any silverware, dishes, drinks, bedding, anything like that. And if to properly wash them or clean them after each use. And then to make sure that you're cleaning all your surfaces at home. So any high touched areas such as countertops, tables, doorknobs, anything that's a high touch area should be disinfected with appropriate cleaner. It has to be EPA approved to kill the coronavirus, and those are available, and we can get you a list if you need one, to make sure that that is being done. So when medical treatment is needed, is when your symptoms worsen. So those can include an increased difficulty breathing or your shortness of breath has worsened, persistent pain or pressure in your chest. If there's any new confusion or the inability to arouse a family member, or if there's bluish coloring on the face or the lips or the nose, that just means that they're not getting enough oxygen, and that is an immediate medical need that needs to be addressed. You have to make sure you're calling your healthcare provider before you go in and telling them your symptoms. And then everyone should be wearing a face mask when they're out in public. So this should already be taken care of. But if a face mask is not available, you will be asked to put one on when you enter the facility. And then if emergency services are needed, and you have to call dispatch or the Winnebago Police Department, they will ask you the screening questions, and you need to make sure you're notifying them of your symptoms and then answering the questions. That's going to keep everyone safe within the healthcare facility, the EMS staff, and yourself. And then once they arrive, they will be asking for you to put on a mask, and then they will probably be in full PPE as well. So next is going to be Laura Gamble, and she's going to go over how this has affected the Winnebago community.
All right, good afternoon, everybody. A lot of this has been over before, but we just want to make sure that everybody is aware of everything. So currently, again, there are no positive cases reported within the Winnebago community. Right now, patients are all entering at the east entrance of the hospital, and employees have been given special instructions on when and where to enter and exit the building. All patients and employees are now being screened at the door for possible COVID-19 exposure. Anyone that enters the building will be required to wear a mask. Mask will be provided at the door by the screener if you do not have one. So if you have a cloth mask and you come in, that is fine. But if you don't have one, because we know not everybody has one, then we will provide a mask for you. Patients are instructed to call their healthcare provider or COVID-19 hotline before coming in to seek any medical treatment. All right, we do have new visitor restrictions. We just want everybody to realize that and understand that. And due to the COVID-19 concerns and to comply with the CDC guidelines, 12 Clans Unity Hospital and Winnebago Public Health Department must take steps to reduce the risk of exposure in our community. Although there are currently no confirmed cases of COVID-19 in our local area, the fewer people with whom our patients come into contact with, the less likely they will be to contract COVID-19 or other infectious diseases. For this reason, we are implementing visitor restrictions for all areas. Effective immediately until further notice, no visitors are allowed in the healthcare facility. In the case of a minor or a person with limited ability to understand or communicate, only one accompanying adult is allowed. In that case, the individual must be 19 years of older, either an immediate family member, power of attorney, guardian, or patient representative. Any adult accompanying a minor or incapacitated patient must be healthy with no symptoms of fever or respiratory illness. The guest Wi-Fi is also unavailable at this time, and we want to thank everybody for your understanding and cooperation with this. All right, so right now, there are some other measures that we have put in, other precautionary measures. We're limiting the number of people in the facility to decrease the chance of exposure. Staff and departments throughout the hospital and health department are being rotated, and some are on telework or working from home or on a leave status. The purpose of limiting and rotating the staff is to ensure we can continue operations in case anyone becomes sick and to limit exposure. And additional supply orders have been placed, and we are monitoring existing supplies to make sure we have proper personal protective equipment for staff and masks for patients who need it. And right now we do have personal protective equipment. We have enough for our staff. I want to go over the testing process because there's always a lot of questions on that. So capacity and supplies for COVID-19 laboratory testing cannot meet the current demands. A simple clinical diagnosis without a test of COVID-19 infection could include self-isolation and should be the norm, even in the absence of a positive COVID-19 lab test. This could change as more testing becomes available and expands throughout the state of Nebraska. If COVID-19 testing is limited, meaning criteria is met, then a test will be sent to an outside lab. Current turnaround time test results for the state lab is 12 to 24 hours and 5 to 7 days for a commercial lab. 12 Clans Unity Hospital does have some limited testing capabilities, and strict criteria will need to be used to review who should be tested. Evidence suggests that greater than 80% of COVID-19 infections are mild, which means there's a fever. Fever is variable with COVID-19 infection, and there may be absent. And they might not even warrant a healthcare visit or a lab test. So I want to go over the current testing criteria, and this really is used throughout the state right now. So any inpatient will be tested. They will approve a test for that. Outpatient, persons in these groups with a clinical or rule-out diagnosis of COVID-19 can be tested at the Nebraska Public Health Lab. And here are the people that they are prioritizing: healthcare workers, public safety and first responders, EMS, law enforcement, firefighters, residents and staff at nursing homes where there are positive cases, resident and staff at group homes, homeless shelters, and daycare facilities where there are positive cases, and individuals 65 years or older with serious underlying medical conditions. So a few things that are happening in areas in the hospital and the outpatient clinic. All routine, non-urgent elective clinic appointments are being rescheduled to a later date. Effective 3/20/3/20, we did change all clinics to Monday through Friday, and it will be express care access or walk-in access. Patients should call ahead for same-day appointment. Starting 3/21, there will be no express care clinic on Saturdays until further notice. And plans are in progress to increase telemedicine in the outpatient clinic and emergency department so that it protects our providers and protects the patients from getting sick. So in the emergency department, if you are experiencing mild illness, please call ahead and get guidance on whether you should come in or you should use self-care measures at home. The emergency department is open as usual, but we are working on plans to care for an increased number of patients. If you come to the ED with respiratory symptoms, such as a cough, shortness of breath, fever, you will be asked to put on a mask and placed in a special waiting room away from other patients without respiratory symptoms. And we've gone over this a few times with the pharmacy. They're now filling 90-day supplies. We do have the temporary drive-through pharmacy, which is Monday through Friday from 8 to 5. Patients really should call ahead so that their medications can be ready. If you don't, it will take a little longer. We do have staff wearing personal protective equipment or protection, and you can get over-the-counter medicines like ibuprofen and acetaminophen or Tylenol through there. And then regular inside pharmacy hours do continue, but we try to use the drive-through as much as possible. Right now, I'm going to introduce Sarah McIntosh. She is a provider in the ED, and we thought it would be very good to go over some scenarios with you, one from the outpatient clinic and one from the ED. And Sarah's going to do that for us right now.
Good afternoon, everybody. The first case scenario that I'm going to go over is a clinic scenario. So a 73-year-old female with a history of heart disease has a fever, slight coughs, and sore throat. The patient is not short of breath and has been managing her health at home, but is worried about the fever. The patient calls the clinic and is instructed to come to the clinic alone. She is to enter through the East ER entrance. The patient is given a mask and a nurse escorts the patient to the clinic. A nurse wearing proper protective equipment, which includes a mask, face shield, eye protection, and gloves, takes vitals and does an assessment. The patient has a temperature of 101, and otherwise all vitals are normal. The provider wearing protective equipment, which includes a mask, a face shield, eye protection, and gloves, does an examination. The provider feels that a COVID-19 test is needed as the patient meets the testing criteria. In this case, the patient is over 65 and has heart disease and other symptoms. With approval from the state lab, a nasopharyngeal swab is done and sent to the state lab. The results will be back in 12 to 24 hours. The patient is sent home with instructions to self-isolate and perform home care measures. The public health nurse will follow up with the patient, and the provider will inform the patient when the test results come back. The second case scenario is a case scenario from the emergency department. So a 58-year-old and the EMS, I should say. So a 58-year-old male patient with a history of diabetes is taken to the hospital per ambulance. He has been sick for 1 week and has been complaining of shortness of breath and is very tired. He did not have a thermometer at home, but his wife states he has felt warm all day. He has been taking Tylenol at home, which helps for a short period. The EMS team wears full personal protective equipment to transport the patient. They place oxygen on the patient and explain to the wife and family that they are unable to come to the hospital due to the visitation policy and for their own safety. They ensure the family that they can call the hospital at any time and they will receive updates on the patient. The emergency department staff is alerted ahead of time and is also wearing full protective equipment, which includes a mask, a face shield, gloves, and a gown when the patient arrives. The patient is taken to a special room if available, and the nurse does an assessment. The nurse notices that the patient is breathing very hard and fast and has a temperature of 101.9 orally. He is also getting confused and his oxygen level in his blood are very low. The patient continues to have oxygen on, but is not helping much. The nurse immediately gets the provider, who is wearing all full protective equipment. The provider does an assessment and feels the patient needs to have a tube placed into their airway, and the patient will be transferred to Mercy Medical Center. The provider is unsure whether this patient has COVID-19, but will inform the accepting facility, which is Mercy, that there is a high suspicion of this patient with COVID-19 and will ask that the patient be tested at their facility and inform us of the patient's results. The patient is transferred per helicopter with special protective equipment for the safety of the crew. So what can you do to prevent the spread of COVID-19? Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, after blowing your nose, coughing, or sneezing. If soap and water are not available to you, use hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and fingers and rub them together until it's all dry. Avoid touching your eyes, nose, and mouth when unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in the community. Stay home if you are sick, except to get medical care. And on the behalf of our entire WCHS team, we appreciate your cooperation and efforts to keep the community safe and healthy.
All right, Garen, are you still there?
Yep, Emily, I'm still here.
So that wraps up our presentation from the Winnebago Comprehensive Healthcare System. So do you want, I think, the tribes next?
Yep, we'll go to the CEO of the Winnebago Tribe, Esther Mercer, and she's going to be joining us via telephone. Esther, are you there?
Yes, I am. Good afternoon, everybody. Are you guys able to hear me fine? Okay. Updates on the tribe. The tribe had to make the difficult yet necessary decision this past week to furlough several of our staff due to the reductions of revenue that resulted from the closure of our casinos. We are currently able to maintain the essential positions despite having a reduced workforce. So we are able to continue to meet the needs of the community during the COVID-19 pandemic. Information on the tribe services is available on the tribe's website and will also be published in the next issue of the WIN. We want to continue to assure our membership that food distribution, WIC, and human services are all operational and able to continue to assist community members who may be struggling with food security and other financial issues. Food distribution can be reached at 402-878-2799. WIC can be reached at 402-878-2499. And human services can be reached at 402-257-5586 or toll free at 833-568-7882. The tribe has continued to meet with other entities throughout the reservation through the COVID-19 Pandemic Task Force to coordinate the efforts between our organizations. Several applications have already been submitted by the tribe to apply for the funds that the federal government has authorized to assist us to fight this pandemic. We are currently encouraging tribal members to continue to follow the guidelines issued by the CDC and the Public Health Department in regards to social distancing. We are also encouraging tribal members to wear protective masks when accessing our organizational services to help prevent the spread of the COVID-19 to our staff that are continuing to work to provide the critical services to our community. And that for now is the update for the tribe.
Okay, thank you, Esther. At this time, we'll go to the Winnebago Public Schools with an update from Dan Farringer, the superintendent. Dan?
Good afternoon, everyone. One of the things I just want to remind everyone that due to the governor's mandate, we will not be in session through May 31st, and that also means no activities. The track and athletic complex have been closed until further notice. Again, the food service staff and those helping deliver have been and will continue to work hard to ensure that children get breakfast and lunch. We are working hard to keep everyone safe, and this means less contact to help prevent the spread of the COVID-19 virus. Tomorrow, Friday, April 17th, the delivery will include meals through next Thursday, April 23rd. On Thursday, the 23rd, the plan is to deliver meals through the week of April 27th, and that also depends on our food supply as the trucks come in and when they get there. So it might only be for 2 or 3 days, but we'll keep going as much as we can. At this time, we don't know the number of days into that week because of the trucks coming in and delivering the supplies. Those families that have been picking up their meals and packets need to notify the school of the delivery point for their meals and packets. We will continue to reach out and get the correct address information, as will be only a drop-off. There will be no pickups. Educational packets will be delivered on Tuesdays. WPS will only have essential staff on duty to help stop the spread of the COVID-19 virus. We are following the regulations set forth by the directed health measures and other guidelines. The seniors are completing a survey regarding graduation. The survey is to be completed by tomorrow, Friday, April 17th at noon. From the results of the survey of the senior students, a plan will be developed, and the plan will be shared as soon as possible. The directed health mandate has put stipulations that are not allowing anything ceremonial to happen through the month of May. With that, I again want to thank everyone for the coming together and working together to try to help stop the spread of this virus, and we're really working hard up at the school to cut down on that possibility. Thank you.
Thank you, Mr. Farringer from the Winnebago Public Schools. At this time, we'll go to the president of Little Priest Tribal College. Manoj, are you there?
Yes, can you hear me?
Yep, the floor is yours.
Thank you, Garen. Before I give an update, I just want to take this opportunity to thank so many people, the Winnebago Tribe of Nebraska, the health system, the public health, the hospital, the pandemic task force, the subcommittees, for their immense contribution to our students, to their families. So on behalf of the college, I'm truly grateful and thankful. Please continue to do your great job, and again, hats off to your performance. Update from Little Priest Tribal College. The first one is the big one, and I really hope you can help spread the word. This is the first time ever summer classes at Little Priest is tuition and fees free. It has never happened before. We just want to help our community. It can be an audit course, it can be a degree requirement. So please contact the Office of Admissions. It's going to be open to the public starting April 21st. Summer school starts on May 26th. Spring 2020, this current semester, last date is April 30th. Just like spring 2020, which is completely online right now, summer classes are also completely online. LPTC, by God's grace, has received some funding from Department of Interior and Department of Education. We are anxiously waiting to receive the money, especially for the emergency student aid. This will help us build our IT infrastructure and also help us, gives technology to students to do their work remotely. So more information will be distributed through the subcommittees so that we can help all our students achieve academic success. I'm happy to report the AICF, the American Indian College Fund, has donated another $17,000 to our emergency student aid, plus 7 high-performance laptops to all full-time faculty. Again, we are truly grateful to AICF. We are working with 12 Clans CEO for possible housing needs for their staff. Currently, we are looking at our new dorms, and the CEO has toured our facilities. Again, we want to be there for the community and for the hospital. So anything we can do, please reach out to me, to any of our employees. Students, as I speak, I get an update from our IT director that we actually now have upgraded our Wi-Fi to the complete strength, where students can drive to main campus and stay inside the cars, the vehicles. They cannot get out. They have to be in their vehicles to do the classwork for spring semester and for summer semester between 9 and 4 p.m. Again, to avoid any contact, we do not want any students to get out of the cars. Starting today, all access to buildings will be stopped to all employees except 8 essential employees. When they do come to the office and access buildings, we are asking the staff to wear gloves, mask, and after every day, we're doing a thorough cleaning of the doorknobs, the handles. All classrooms have been sanitized and completely locked for any access, so that we do not want classrooms to be infected again by any other virus, just not the coronavirus. Wolf's Den is donating food to Winnebago Senior Center. If any of your institution needs any food items, please contact Deb Chamberlain or me directly, of course. We want to make sure that we help any community members, anybody with food requirements. We're installing more cameras through the COVID-19 CARES Act technology infrastructure to increase the security at all campus buildings. We are contacting all the students all the faculty are contacting students through the Zoom classrooms. Our last day of spring 2020 is April 30th, and we firmly believe our graduation rates will not be diminished by this COVID-19. Again, I just want to take this opportunity to thank each and every one. Special thanks to Garen for making this technology work, and God bless, and Pinagagi. Thank you.
Thank you, Manoj. At this time, we'll go over to the general manager of Winnebago's Casino and Resorts, Mayan Beltran. The floor is yours.
Good afternoon, everybody from Winnebago's Casino Resort. I just wanted to give a brief update. For one, we have no positive cases for COVID-19. We did send out a letter on April 2nd to our valued Winnebago's team members stating that Iowa Governor Reynolds extended the closure through Iowa through April 30th, 2020. So unfortunately, that included the casino and hotel. We understand that this is a difficult time and hope you are healthy, safe, and enjoying your families while we wait for the okay to return to work. As a reminder, we have an employee assistance program, the EAP, at no cost to you. Our EAP counselor, Jerry Kuiper, is still scheduling appointments via phone. If you need to set up an appointment with Jerry, please contact him at 712-251-2916. In addition, if you have any questions or need to speak with someone regarding your 401k options, please contact our representative, Richard Lippidrand at 402-578-7021. Once again, we will continue to communicate as best possible during this time and hope to see everyone back to work as quickly as possible. With the state of Iowa, we're constantly monitoring the numbers. As of today, 4:15, or as of yesterday, 4:15, 2020, there was 2,141 confirmed cases, 60 total deaths, and 20,675 tested, 987 confirmed cases. So we're constantly monitoring Iowa and the Governor Reynolds daily briefings to understand how Iowa's going to deal with this, closures and businesses throughout the state. So we'll keep you apprised of that as we find out more information as well. I also want to extend thank yous to our essential staff, security, surveillance, maintenance, essential managers that are still here working, and our managers that are on many of these subcommittees and our pandemic task force for the tribe. So thank you to everyone. That concludes our report for Winnebago Casino Resort.
Thank you, Mayan. For those that are tuning in, don't forget we do have a question and answer session that will be provided by the Winnebago Public Health Department. And if you have any questions, don't forget to email covid@winnebagotribe.com. At this time, we're going to turn the floor on over to Sam Burrish from HoChunk Incorporated. Sam?
Good afternoon. Thank you, Garen, and everyone watching. For today's updates, I'd like to start with our Pony Express convenience stores and Sweetwater Cafe in Winnebago. This week, we've installed plexiglass protectors at the counters and checkouts for each location. This is in addition to frequent cleanings and deep cleanings. The continued reduced store hours do vary by location, so please visit the Facebook page for your location to confirm the hours and also look for signage posted at the stores. Our government contracting divisions remain busy, including helping 12 Clans Unity Hospital secure personal protective equipment. Many of our government contracting and other employees are working remotely. To share information and promote unity, we've been hosting company-wide video conference sessions. This week, we updated employees on the Winnebago community response. Employees across the country tuned in to learn more and asked engaging questions. On the federal response, we are beginning to close on loans that we mentioned last week. These are forgivable loans that were part of the recently passed CARES Act, and they're meant to help small businesses keep employees working. Speaking of employment, we do have a number of part-time community ambassador positions available. These are part-time positions for individuals who live within the Winnebago Reservation and are able to work up to 40 hours per month. That's 40 hours a month. So a great opportunity for college students or others who are looking for work and need that flexibility. So if you're interested in applying, visit the careers page on the HoChunk Inc website or contact Janelle Decora at HoChunk Inc. Those are all of the updates I have for today. I appreciate your time.
Thank you, Sam. And we appreciate as we go forward to make sure that for those folks that are utilizing Pony Express as well as the heritage stores to maintain social distancing, as Sam was reinforcing. And we thank you, Sam, for putting in the plexiglass in the stores to keep the customers as well as the workers safe. So we wanted to appreciate that. At this time, we're going to go over to the HoChunk Community Development Corporation. Mr. Brian Mathers is online here. Brian has some updates for us, and so we'll turn the floor on over to Brian, HoChunk Community Development Corporation.
Thanks, Karen. Yeah, we're basically just focused now on retaining our staff, sustaining our community development programs that have been underway. We have closed our office to outside visitors except by appointment. And we're working our staff hours in shifts so that we've only got half the staff there at any time and they can keep adequate, safe distance apart from each other. And doing, as Sam mentioned too, some of the same things with more cleaning, more disinfecting, just trying to keep a safer work environment for those that can't work from home. Those that can work from home, we're just having them work from home if there's no real distance or difference in the delivery of their work product. So the programs that we're focused on sustaining right now are housing, keeping the low-income tax credit, rental housing properties operated, developing new housing with a HUD project that's just underway out at Thunderway, and our education program, partnering with the schools, the food sovereignty work that we're doing under the HoChunk Harvest Grant Project, and the youth prevention stuff that's going on with Partners for Success. So those grants are all, we're able to maintain those staff people and that project work with that grant funding that was already in place. So we haven't had to disrupt too much of our normal operations in those regards. We're just changing the focus of where the work is delivered a little bit. We've also been involved with the tribe's task force, their COVID response task force, and some of the subcommittees associated with that. So we're on the state and federal grants response subcommittee and the utilities and infrastructure subcommittee and the education subcommittee. We're just looking for opportunities to help any of you guys, anybody in the community that may have a new opportunity that comes down here and needs, if we can be and help putting a grant proposal together or working out a budget or helping with some of that grantsmanship stuff that we're primarily doing all the time anyway. We just want to make sure we know we're on top of what's happening in those subcommittees so that we're prepared to respond to any offers of help that might come from any of our community partners like you guys. So that's basically it where we're at now. We're trying to figure out how and if the new curfew is going to affect programming. I don't anticipate that it will a whole lot. We're just going to make sure that our staff that we do need to have there to respond to emergencies and things have letters on hand that would give them permission if they were stopped or something to continue with their work. So so far our staff is all healthy and their families are healthy and we feel fortunate. I do want to say I have been really impressed with this community and the tribe and the tribal programs and their response to this. I think they've been ahead of the curve. I think they've been proactive rather than reactive. I think they've positioned themselves well to minimize the damage that this will cause and to maximize the opportunities that it might present through federal funding and things like that. So I've been really impressed with that, and I'm happy that our agency can play any role in that as it's going forward. Thanks.
Okay, thank you, Brian. It's good to see you. Make sure you stay safe, and we appreciate the update. Also wanted to make mention that we did receive information from the Winnebago Gaming Development Corporation. Iron Horse and Native Star Casino remains closed. They also want to remind the employees to continue to file their weekly claims. So we appreciate the Sharon Chamberlain from the Winnebago Gaming Development Corporation for that update. At this time, we're going to go over to the Winnebago Pandemic Task Force Chairman, Mr. John Snowball. John.
Good afternoon. The Winnebago Tribe's COVID Task Force met for the 4th time this morning. The task force consists of myself as the chairman, CEO of HCI, Lance Morgan, CEO of the Winnebago Tribe, Esther Mercer, CEO of 12 Clans, Danelle Smith, and CFO of the Winnebago Tribe, Alan Post. We continue to meet weekly and are now trying to make sure we have our meetings in time to get the most recent updates out to you in time for this live stream. Each subcommittee is meeting weekly. One subcommittee has 21 members, and all 21 participated this week. We'd like to thank everyone on behalf of the community. The subcommittees are health, federal funding, food security, business and employment, utilities, communications, security, and education. These subcommittees are working specifically on making sure we are prepared in responding to the COVID-19 threat. The subcommittees make recommendations to the task force, and the task force can make recommendations to the council, acting as an advisory board. Most of the task force members and many of the subcommittee members are part of this live stream, so I'll try not to repeat what has already been shared. Assisting with the council, some of the task force, what they have done is assist the council in decisions and institute the curfew. Looking at ways we can add more security and law enforcement during this time to help with the curfew, but also with the health and safety measures at our businesses in town. We are preparing to launch a food pantry for community members, and more details will be provided on that once it is finalized. We are working together to make sure we have more PPE available to the staff who continue to work, not only for those at the hospital, but for all the other staff, especially those that provide direct services to our community. By working together, we can make sure we have access to all the vendors each of our businesses have relationships with. This is important as many places are running out of supplies, but we are doing well because we are working together. We know that we will need more cloth masks and are looking to see if we can make a small payment to those who can provide those to community members who can make them, and we can distribute through the public health. Garen will announce more on that once it is finalized. Our communications subcommittee continues to research a community-wide communication tool to get information out quickly and to as many members as we can. The federal funding subcommittee is tracking all the new money that is available to tribes and tribal members. That funding will start to be made available next week, so we are tracking all the needs and concerns we are hearing from our members to try and make sure those funds can pay for some of the things, food, rent, access to internet, and our students. Our education subcommittee was created last week, and they met for the first time. One of their biggest concerns is how to address the mental health needs of our students. Our health subcommittee and education subcommittee can now work together on that. We realize that mental health issues for all our community members need to be addressed. So we need to make sure we have an effort, a coordinated effort, so we do not leave anybody out. We know that many of you want to volunteer to help. So if you have a particular skill that you can think of, we would like to bring the work to the task force, please reach out to Garen, and he will keep a list of volunteers and that we can assign to help us when we need it. The projects are being developed now, and when it's time, we're going to call upon the membership, call upon our workforce. The biggest thing I would like the community to know is that everyone is working together. We are sharing information, sharing policies that consist and don't have to start from scratch. This morning I had the opportunity to sit down with Manoj from LPTC, and I was impressed. And I was really glad that we got this education subcommittee going. And one thing that he said stuck with me, and it was, he said, the education must not stop. And I think that applies to many areas, that we cannot stop. And we have everybody working the problem. We got our best people and all of our resources working together. So please stay home and stay safe. Thank you.
Thank you, John. At this time, we're going to turn the floor over to Emily from 12 Clans Unity Hospital. She is the communications manager for the question and answer session. Emily.
Thank you so much, Garen. So just a reminder that if any community members have questions, that they can email covid@winnebagotribe.com your questions, and we will answer them on next week's live stream. You could also, in the chat section of the live streams, you can ask your question, and we will do our best to get those asked and answered this week as well. So I'll start off with the first question that came through email. They wanted to know, when do you think it will be safe, and what's the best guesstimate based on the daily updates? So I'm going to direct that to the public health department. If Mona, you could answer that.
Let's see, I would say that's pretty hard to determine, but if we're looking at what's going on in the East Coast and the West Coast, and we have been about a month behind or so, I would say at least the next 2 weeks would probably be the most critical time for us. And so we should be really staying home and doing what we can. So I'm hoping that I'm not a clairvoyant, so hopefully maybe by the end of May, we can start looking at some recovery processes and bringing people back slowly. But this is going to be a long haul. So it's not going to be something that all of a sudden we don't get cases anymore and we get to all just come back to work. So I don't believe that is what is going to happen. I think everything is going to be slowly coming back, and we have to be mindful that a lot of the researchers are talking about another influx would start maybe back in the fall time. So we need to be mindful of that as well. So it's not a exact science saying that, you know, tomorrow it's going to be all better, but all we can do is continue to plan, prepare, which is what we've been doing for the last month or two, and just doing the best we can with what we have and what's presented in front of us.
Thank you, Mona. Another comment from a community member. They said, thank you for doing this live stream. Your team is amazing and I encourage my relatives to watch. Do you guys give presentations to urban Indians that are in your service area? So obviously, I think, Mona, that's again a question for you for the public health department.
So right now we're really just trying to encourage our social distancing. We've been providing a lot of go-to meetings, Zoom meetings at times, depending on what the platform and who we're presenting to. So if there are urban Native organizations that would like to directly contact us and we could try to put something together, of course, you're always welcome to watch all of these lives and send questions in. And I'm sure my information is available somewhere.
And also people, reminder that we still have the COVID hotline too. So there's also a resource. Okay, great. Next question. I noticed that I haven't been eating healthy and doing a lot of activity lately. I'm older, so what are some safe ways to exercise around the house? Angie, is there an answer you could give from the public health nursing perspective?
Yeah, so obviously the best thing we want to do is to keep you safe and healthy. So the exercising inside the home is something that everyone can do no matter the age or their abilities. One thing you can do is just kind of walk around your house and just do laps around your house and try to do that each day. Some people that are a little bit older might have a little bit of problem with balance. So it's always a good thing to grab a chair, and then you can always do leg lifts or arm lifts or squats. You can take household items such as canned foods, and you can use those, and you can do arm exercises with those. Those are about 2 pounds each, around that. And then that's always a good thing to do to help maintain your activity. And then just doing other things. You can turn at the waist and just to hold onto a chair and then swing your arms and turn out your waist and just try to keep active, but just make sure if you are doing that within the home that you have a safe environment that's free of clutter, that gives you space to move, and then that isn't gonna prevent and hopefully will prevent any injury from happening.
Okay, great. Thank you, Angie. So I'm going to direct this next question to Sarah because it is specific for healthcare workers. So a community member asked, the healthcare workers being on the front lines, what are you seeing the most of, and is there anything that we could do to help?
Yeah, so the top 2 diagnoses that we've been seeing in the last week has been ear infections and sore throats, along with strep throat. What you can do to help yourself and the community is just follow the instructions that public health has given, such as social distancing, staying home, making sure that you're washing your hands very well and wearing a mask so that we can help stop any spread of the virus or any other disease process in the community.
Thank you so much, Sarah. So this is actually a part 2 to that question, and it's more towards the mental health. So Mona and Angie, if you want to jump in on this too. There's been concern about the mental health of the community currently. They want to know if there's been an uptick and if there's any resources or things they should do in regards to behavioral health and mental health concerns.
So I think we need to all do our part for mental health, FaceTiming, calling, checking on loved ones, especially now that we need to continue our social distancing. Exercise is always important, getting fresh air. As I indicated in my beginning, we do still have behavioral health services. So if you want and wish to speak to somebody, you can always call 402-878-2911. We also have the crisis number available. And so mental health is so important. And I know John alluded to that we are looking at that through the subcommittee task force on the health and the education side. And we're trying to put out information that's relevant to our community. But you can always call the crisis line if you are needing that.
Great, thank you so much, Mona. Laura, this question is for you. It's in concerns to the hospital. They want to know, with the pandemic going on, has it slowed or stopped the hospital's CMS certification process?
So, of course, a lot of our time right now has been, looking at the processes for COVID-19, but we continue to always every day work on that certification, recertification, what we can do. And a lot of the processes that we're doing now will help us with that recertification. And so we don't know on the government side what that will do as far as the surveyors being able to come out once we do put our application in. They aren't doing surveys right now unless there's a need to do a survey. There's a problem spot somewhere. So we really aren't sure how on the government side this is going to affect the timeline for the survey. But every day we're working on the recertification.
And Laura, we did just get a message on the live stream. Somebody asked if Contract Health is open because they had a billing question and issue. Can you advise on that?
Yes, they should. I don't know the number, Emily, off the top of my head, but they should be able to call there. And there's always somebody, if they just call the front, they can ask for, there should be somebody there to answer the phone at all times.
Great, thank you. And then another question that was submitted by email. A community member said, my kids' sleep schedule is bad. They stay up sometimes until 4 a.m. playing video games. What is the best way to keep them motivated and disciplined during these times? So I'm going to direct that towards the public health department.
Yeah, so with this time, obviously there's been a lot of change within the home with kids not going to school and parents staying home, and then just having more not as strict schedules as what was previously when they were in school and everyone was kind of living their daily lives. It is important to go ahead and try to create some schedule or some routine for everybody in the home. It will help kind of keep that stability that everyone's kind of missing right now. And then a good thing is to set the amount of screen time that's allowed with each day, limiting the amount of time that they have on that screen. That can kind of create problems when going to bed. The color and the stimulation and stuff makes it harder for them to wind down and go to bed. It's important to make sure that everyone's eating healthy, as healthy as what they can be, trying to cut down on the processed foods and the foods that are high in sugar. That'll help as well. And then just staying active, just because we want to maintain that social distancing, but we still want everyone to stay active. So going outside and going for walks and making sure that when you're outside that you do have your mask on if it's available, and just doing that and just staying active would help kind of give some of that energy out as well. But just creating a routine and a schedule and trying to stick to it the best we can. I know it's a difficult time for everybody, but just trying to find a new normal for right now.
Thank you, Angie. There's also been a comment, community members wanted to know, is it true that there's a confirmed case of COVID-19 in Homer?
So with that, Homers in Dakota County. There has been 3 confirmed cases in Dakota County, but they are not disclosing the exact residence or the town that those 3 individuals are live in. So it's not known if they're in Homer, but there has just been 3 confirmed cases in Dakota County.
Thank you for that information. Laura, this one is directed towards the hospital. So it said, how about, is it possible to give the essential workers a full blood workup test for COVID-19 to be preventative?
So right now, testing, like I try to convey every week, it's really limited in the state of Nebraska. You know, they aren't testing asymptomatic people unless there's a breakout or it's an area where the state lab wants to look at. And so we can't automatically just send tests there because somebody wants to be tested. They have to have meet the criteria or have the symptoms and some of the other criteria. So if we do have employees that come to us with those criteria and they meet the criteria, we will test them, but we can't automatically just test everybody at this time.
Got it. Thank you. We've had some questions about healthcare position and healthcare workers in general. So I'm just going to throw these out to whoever on the live stream panel can answer them. So the first question is, with the COVID relief funding, will there be any immediate health positions available? And second part to that question, is it possible to pay healthcare workers extra during this crisis? Community members want to request on behalf of the hospital workers extra pay.
So I can start with that. This is Laura. You know, we appreciate every person that comes to work every day here, and we want them to know that they're appreciated, and we have worked very hard to try to keep them safe and so that they understand they are very important to us. We couldn't do this without them. We meet weekly as a team, and we discuss schedules for staff. We discuss how do we, keep staff healthy, and this is something that we have not necessarily discussed, but could be on the agenda at some point. But we do appreciate everything that the staff does at this time.
Alluding back to the first question, to discuss some of the immediate health positions. So each of the funding sources that that the tribe has put in has specific language in there, depending on the needs and what they've been doing. So I can't say yes or no at this time. So it really depends on whether we receive that funding and if we're able to use that with existing staff, or it will be new positions.
Great. So kind of going along with that, there was a comment that said, I recently got laid off by the tribe, but the person wanted to volunteer and keep busy. So is there any recommendations or ways that they could volunteer to help?
So I think John alluded to this, but to contact Garen if you would like to be on a list for those that would like to volunteer. I'm not sure what that may entail of what you would be signing up for at this point, but it is a way to help with the community. I know when they did the buffalo harvest that there was a lot of community members that volunteered at that time. And so I'm sure that anybody that wants to volunteer would be greatly appreciated. And of course, if you like to sew, we are asking for donations of face masks to the CHR program so that we can give back to the community that needs them. And then also I got a text about the activity for some of our elders. We did have a post on our Winnebago Public Health Department Facebook page for chair yoga. So I would invite you guys to try and look at that and see if that is something that you would like more of, and Whirling Thunder can look at doing some more of those activities online.
Great, thank you all so much. So that wraps up all the questions. There's been a lot of comments, just so everybody that answered of thank you and great job for everybody answering those comments as well. Garen, gonna throw it to you. Do you have anything else?
Yep. Thank you for the health questions, and now we'll direct our attention to the chairman, Coley Brown, as well as the chairman of the Pandemic Task Force and vice chairman of the Winnebago Tribal Council, John Snowball, for your folks' questions. And so we'll get started with the first question that everybody wants to ask. And I believe we'll kind of direct this to John, is how is the curfew ordinance going so far?
So I believe it was probably about a week and a half ago, we made a motion at the council table to develop an ordinance, should we need it, to have it on the shelf ready. And with this COVID-19 on the borders of our reservation, we felt it was time to enact the curfew. And I know that a lot of debate is on the time. And we decided on the time of 7 p.m. to 5 a.m. It's a 10-hour time frame, but I believe it to be very reasonable. Well, we chosen that because it's going to be difficult to go and get groceries every day. You know, we want to encourage our community members to plan, to shop for 1 week, 2 weeks if you can, to really plan out your shopping trips and just send one member of your family and take all the precautions that you can. And the tribal council understands that this is only one part. You know, there's no single motion that can keep this out of our community. It's a lot of motions in a lot of areas on all levels that we can be preventative. And this is just one. You know, we're not saying this is going to fix everything, or this is going to keep it out, but it's one measure. And in conjunction with the other measures, you know, we're hoping for the best, that we want that safety in our community. So yesterday was enacted the curfew ordinance, and myself and a few of the wildlife officers, we went out at 7 p.m. and I was really impressed by the community and on how they honored this curfew, and how they know that it's meant for the safety and the health of our community. And when I patrolled, you know, the town was quiet, and there was nobody on the roads. You know, we did give out a few warnings, but it was, I was impressed, you know, and I really liked it. And we even went to the Dollar General, and there was nobody at the Dollar General. We went in, we talked to the workers, and to see that the Dollar General has changed their hours to fit our curfew is what should happen. That's the way it should be. You know, this is our community, and we like to see that they're finally going to take those measures, take some responsibility for our community members. So I would say that it's going well, you know, and we're watching it, and again, it's one thing, you know, and there's a lot of other things. So I want to say thank you to every community member that is taking it serious. And like I said before, and I like to keep saying, is it's going to take all of us, you know, each one of us. There can't be a weak link for it to get in. So, thank you.
Thank you. This one is directed towards Mayan. Mayan, this question is coming from a community member. They would like to know if there's anything out there that they can get their bingo fix or their casino fix. Do you recommend anything?
I wish that was possible at the time. We are following recommendations of no more than 10 or more people in a business to mitigate the spread and for safety of team members and guests. We are looking at a couple promotional situations with marketing as far as doing some kind of promotional deals through digital or websites and things like that, so that when we do open back up, we'll already have winners that can come in and collect and then begin their gambling again. And on bingo, the same thing. There's some stuff that we have to look at, and some of that is we have a Wire Act, and we have certain things that we have to comply with the NIGC. So unfortunately, there's not much we can do with gambling itself, like casino or bingo. But we are looking at some ways that we can do some promotional things for our guests, so that when we open back up, they can collect some winnings and keep them engaged while we're closed.
Thank you, Mayan. This one is for Little Priest Tribal College. They want to know if there is a password to get on to the Wi-Fi at the college.
Great question. Can you guys hear me?
Yep.
Oh, okay, thank you. We have two ways to access our Wi-Fi. One is basically through the Little Priest website, Little Priest Access account. That will give us a highest bandwidth. And then for, if you're a general public and not a student, we have a free Wi-Fi available, has a very low bandwidth. So we have both options based on whether you're a student or a staff. Students will have the highest bandwidth access.
Thank you, Manoj. This one is for Chairman Brown. Do you folks offer loans in this time, and what is the criteria to get a loan?
There's a program called our credit department, and that would direct you.
Is that open for all community members or just tribal employees?
Our working tribal members.
And there is nothing for the community members at this time, right?
I am not sure on that.
Okay.
Just call the credit department and they will direct you.
This next question is for food sovereignty. I'm not sure if Brian wants to take this question or if John wants to take this question, but they want to know if the Harvest House is still offering seminars and what the schedule is to start planting.
They are. Manoj, you might want to weigh in on this too, because the tribal college is still offering some of the online seminars and some digital distance learning seminars for the planting season and gardening season that's coming up. We do have some additional raised flower or raised garden beds that were just ordered. Those will be distributed, and the college is going to partner to do plants and seeds for the gardener. So yeah, that stuff is all still planned. We're not 100% sure how the farmers market situation is going to work because of the social distancing, and we're going to need to watch what happens over the next couple of weeks to make a decision on that. But the home gardening component will still be up and running, and the extension office through the tribal college is still going to be providing technical assistance for growers.
Anything else to add, Manoj or John?
Yeah, I can add a little bit. We are meeting either tomorrow, to discuss about our plans for extension and how we can serve the community. So we should have a bulletin or a notice or some information we're going to share to the community of how best to access the seeds and stuff like that. So look forward to sharing with the public very, very soon.
This one is for Chairman Brown. The Omaha Tribe had posted that Governor Ricketts had pulled out of an agreement. What is Winnebago Tribe? What is their stance on that state funding?
Yeah, we took a phone call today, and we are too a little disappointed with the state, but I think they reneged on that funding to wait to see what these federal dollars do. And I would think if we need help and those federal dollars fall through, that the state should step in. But we are self-sufficient. We can cover ourselves. We have resources, we have the funds, but again, we will be out there looking for assistance. We will be drafting a letter and sending to the state, showing our disappointment of them withdrawing that and giving that money back to the state government.
Thank you. This one is kind of a request, maybe from two directed at Sam here. They would like to see pictures of the cattle and kind of the schematics of how many we purchased and where they located and what the plan is for the purchased cattle.
Sure. I can talk with Aaron LaPointe. I know he's really excited about that project, and we'd be happy to provide some more information to the community. If you are on Facebook, you can look up HoChunk Farms and see some of the things they've been up to this spring, and I'll work on getting additional information about the cattle and other sustainability and sovereignty projects.
Last question here for Chairman Brown. Does food distribution, now that we are laid off, are we able to get into the program?
Yes, I believe so. You would just have to call down there and check. I would say yes. Of course, it's always income. Depends on your income.
Okay. With that, I believe that closing statements by John and Chairman, and then we'll wrap up today's weekly live stream. John?
I would like to say that I try to look at things in a good way. You know, there's this virus traveled from the other side of the world, and it's here, and it's doing something. You know, it's not in our community, and I say that preventative measures is a hard sell because, you know, there's really no payoff. You know, we don't have it, and then nobody knows if it's because of what we're doing or if we'll get it. So, but it's revealing stuff to us, and I think it's valuable. It's showing us our weaknesses as a community, and we're going to learn from that, and we're going to become stronger. We become stronger in our food sovereignty, become stronger in providing for our most needy, and moving forward, you know, we're creating that path. These are unprecedented times, and in turn, we have made unprecedented actions. You know, there was no playbook for this, but I'm proud of the council. I'm proud of all the workforce. I'm proud of the community on how we're reacting and how we're being active. And, you know, I never thought that this, you know, me 7 months into the tribal council, that we'd be sitting here, you know, but we are. And this is what I stepped forward to do. And, you know, I won't back down. You know, I'll stand up against anybody and anything for our people. And more decisions are coming, and we're gonna keep going together. Thank you.
Chairman Brown.
Thank you, John. Those are the kind of words we need and people we need to help all of us get through this. I want to thank everybody that was here today, that sat in on the update. I believe we're doing a wonderful job, a great job. Thank you all. As I said, we are self-sufficient. We've done this. We've accomplished this. I want to thank past councils, tribal councils, who've done this for us. Bottom line, Winnebago Tribe has money in the bank, and that will help us. We have resources to get us through this. This is all new for us. We're writing a book of how to handle this next. In closing, I guess I'm encouraged when I see daily the amount of people that are recovering from this without being hospitalized. So we're learning more and more daily. This is coming out, and we will survive. We will get by. Just hang in there. Follow all the precautions that are being told to us. Social distancing, wash your hands, stay home, and we will get through this. Thank you.
Thank you, Chairman. And for those that are tuning in, make sure that next Thursday you mark your schedule, as we'll be doing the same thing. And we do have a little treat for those that are still staying on the live stream here. We're going to turn it over to Emily, and we want you folks to help us out with a Facebook frame. But let us know a little bit more about that, Emily.
Yeah, so the Winnebago Pandemic Task Force has launched a Facebook frame to promote the message to stay home. So we are encouraging everyone to apply the frames to their profile picture by doing one of two ways. You can go to the Public Health Department's Facebook page, make sure you like it. But if you scroll down, you'll see the post of the frame, and at the bottom there's a button that says try it. You'll just click on that and it will apply to your profile. Or you could just go to your own profile, click add frame, and then search keyword Winnebago, and it is the first one that comes up, and you can apply it to your profile that way. It just says stay home to protect our elders, and it is a joint collaboration with the Winnebago Pandemic Task Force to spread the message and encourage everyone to stay home and stay safe.
Thank you, Emily. With that, you folks stay home, stay safe, and God bless. We'll end the live stream.
Thank you.
Thanks, everybody.